and it's the newly enacted federal ban on genetic discrimination and really what it means to you. And delivering this is Jennifer Leib. She's a partner at HealthFutures LLC, an expert in GINA, and she's going to take us through, again, what GINA means for us as a community, for you as an individual. So at this point, I am going to turn control over to Jennifer. We'll see her slides in a second.
Great, thank you. Are the slides up yet, or?
Not yet.
Okay. Well, while we switch the slides, I'll share a little bit about my background because I always find it helpful to know who I'm listening to. I am a genetic counselor by training. However, I have not been in a clinical or research setting in about 7 years now because I transitioned to policy. I worked in Senator Kennedy's health policy staff for 2 years working specifically on GINA, and then left the Hill and was an advocate for the past 5 years getting the bill passed, and then still lobbying for the bill as it's finalized in its regulations. And I'm going to talk a little bit more about what that means in the talk.
So Jennifer, if you just click Show My Screen, we should be able to see your slides.
Great. Okay. Oops. How about now? Great. So I'm going to go through the Genetic Information Non-Discrimination Act, which I'm going to call GINA. As pretty much I'm assuming most people know on the phone, it was signed into law May 2008. It officially took effect this past November. So GINA is in effect 100%. We are protected. I'm going to go through what that means. And then also, just so you know, GINA trumps all state laws. So most states, by the time we passed the federal bill, most states had already had some law on the books for health insurance and or employment. But it was very much a patchwork quilt, and some states were stronger than other states, and it wasn't consistent. And so GINA essentially sets the federal floor. States can pass laws that are stronger, but at the bare minimum, every single person in the U.S. has these protections under GINA. So there's two titles to GINA. The first one has to do with health insurance. And as you can see, sorry, my screen just went. Okay. Sorry about that, guys. So the first title is health insurance. And essentially one of the most important points in this bill that I want to make sure everyone is clear about is that your health insurer cannot request or require a genetic test or genetic information from you. So a very simple rule of thumb is your health insurance company has violated GINA if they've asked for your genetic information, pure and simple. Additionally, they can't use your genetic information to make a determination as to whether or not you're eligible to participate or enroll in one of their plans. They can't use any of your genetic information to determine how much your contribution or premium is going to be each month. They can't use it to make decisions about which procedures or tests or other treatments they're going to cover. And they can't use your genetic information as a pre-existing condition, so they can't bar your enrollment because of your genetic information. Now I'm going to pause, and all Obama signed into the health care reform bill, and one of the big, I guess, wins in that bill is that now all insurance companies cannot use pre-existing conditions, period, whether it's genetic or not, to make an enrollment decision. And that was a big win and a big protection. GINA already gave that for genetic information. So essentially the health care reform bill that just passed extended that protection to all types of health information. Why GINA is still important, though, is GINA says you also can't use that information for that underwriting, so setting the premiums and making coverage decisions. Healthcare reform did not do that. So GINA is still really important even though healthcare reform passed. There are, and I say we, there's a group of us forming here in D.C. who are longtime advocates for GINA who are going to do an analysis of what the healthcare reform means in terms of how it interacts with GINA, and hopefully that will be available later this summer in a few months, and I think that will help a lot of confusion. But some people I've heard saying, oh, now that we have healthcare reform, we don't need GINA, but we really do. This bill goes way farther than anything that was passed into law last month. And then last, GINA applies to both group and individual plans. It does not matter if you are self-employed and have your own plan, or if you're part of a huge company that has 100,000 employees and part of their group plan. You're covered under GINA. So I said that health insurers are not allowed to ask for your information, and that's a very key point. There are some exceptions in the bill, and one of those is if the insurance company is doing research. Oftentimes, health insurers they have a huge population of patients, and it's a great wealth of information for them to study things such as outcomes of different treatments and the quality of the health care their providers are giving the patients enrolled in their plans. So oftentimes they'll do research. GINA says you can collect genetic information as part of research if the following conditions are met. It has to be informed consent. The request actually needs to be in writing, which is a lot different. Sometimes insurance companies just mine the data because they paid for your health care. They have the right to look at your records legally. So sometimes they'll just mine the data, but in this case they actually have to inform consent and request in writing to look at your genetic information. And then they can't use anything they find, any of the research findings, for underwriting. So again, that really important key point that they can't underwrite with your information. They also must notify the Department of Labor. You might be saying, why does a health insurance plan notify the federal agency that oversees employment? And the reason is that the existing laws that GINA amended are actually under the jurisdiction or oversight of the Department of Labor. So they are essentially the federal agency that's interpreting and implementing the bill. I put in red, because this is a really key point here, is that as they're doing this research, they can only collect the minimal amount of genetic information necessary. So perhaps to answer a research question, they may only need your family history. They may need a genetic test result. They might need more than that, but they can only collect the minimal amount necessary. So this is a key factor that was in the bill. Again, attempting to protect us from practices that health insurers might do to try to get access to information we want to keep private. So there's another exception in the bill when a health insurance company can request your genetic information, and that's when they're making a payment determination. So I said that a health insurer cannot use your genetic information to make enrollment decisions, to set your premiums, to determine which tests are covered. That's all true. However, let's say you are a BRCA positive individual and you want to have a bilateral prophylactic mastectomy. That's a very expensive procedure. A health insurance company would probably want some adequate evidence that it's a necessary procedure. And so if they're going to cover that test, they might request to see evidence that you are at higher risk for breast cancer. That could be, again, the minimal amount of information necessary. So that could be family history. That could be your genetic test result for a BRCA gene, but it has to be the minimal amount necessary. This is a gray area. The legislation doesn't define what is minimal amount necessary. GINA just says they can only collect the minimal amount. When the agencies, so the Congress passed the bill, the President signs it into law, and then the federal agencies interpret the bill and actually draft regulations so that employers and health insurers and us know how to comply with the new law. They interpret it for us in those regulations. The regulations give examples of what they felt Congress meant by minimal amount of information necessary, but they didn't give an exhaustive list of examples. They give 3 or 4. So there's going to be instances as GINA gets implemented down the road as more and more examples that we didn't anticipate come up. There's going to be these instances where people question, what does this really mean? Is family history enough? Do you need a genetic test result? Do you need more than that? And we'll see those discussions playing out in the real world, and you'll start seeing some court cases where people file claims because of GINA, and the government has to respond to it, and this legislation is going to continue to get interpreted over and over again, just like all the laws in the land do. Bills like the Americans with Disabilities Act constantly gets challenged and all the way up to the Supreme Court level, and you're probably going to see that 5-10 years from now with GINA. So again, a health insurer can request information if it's related to making a specific determination about payment. Another key thing with this, though, is that policy has to be consistent to everyone enrolled in that plan. So if you want to get coverage for bilateral prophylactic mastectomy and they require a genetic test result, that same requirement has to be for everyone. They have to treat you all the same. And that it sounds like a minor detail, but in insurance law, that's actually was, again, a really big win for those of us in support of GINA. The second half of the bill has to do with employers. And essentially what Title II says is your boss cannot use your genetic information at all. They can't use it to make a hiring decision, a firing decision, whether or not to promote you, how much to pay you, whether to not give you vacation. They can't use it for anything. They also, and again, this is a huge, huge win, they can't request or require or even purchase genetic information. Believe it or not, employers all the time are purchasing information as they screen out who they may want to hire, and there's lots of information out there available. And this bans them from, so again, they're not asking you as an employee if you've had a genetic test, but it also bans them from going and purchasing that information that may be out there. There was a lot of, when we were negotiating the bill, there was a lot of back and forth about what about those water cooler conversations. It's unintentional. The boss just happens to be in the break room getting some coffee, and over here is one of his employees talking to another employee about a family member getting diagnosed with an inherited disease, and they're concerned about themselves and wanting to get tested themselves. The employer didn't intentionally go after the information, but now they have it. So GINA says as long as they don't act on that information, they don't use it, then they are in compliance, they haven't violated the law. Additionally, any information, let's say they got a copy of a genetic test result, or let's say you filled out an application for Family Medical Leave Act, and in that application to take family medical leave to care for a sick family member, you had to provide information about that family member's health condition, which happened to be genetic. They now have that information as your employer. He or she has to keep that in a separate file, separate from your other human resource records, your other employment records. They can't act on that information. Now, it gets a little tricky here, and this is why GINA is going to constantly be challenged and questioned and interpreted, is an employee might feel that the employer acted on that information, but the employer may feel that they were in compliance. And we're going to see these cases come out now more and more as the bill gets implemented. We're going to start to hear about cases where people are trying to challenge the interpretation of the law. Just like with the health insurers, there are some exceptions for employers and that does allow them to collect information. The first one's in law enforcement. If you work for a police department and you're often at a crime scene where they're collecting samples such as hair samples or blood samples from the scene to try to identify a criminal, the police department or law enforcement agency will collect a DNA sample on their employees to use as a control so that they can make sure that the hair sample at the crime really was a crime scene sample and not just a hair that fell off one of their police officers who happened to be in the room. So it's more of only for identity purposes. They can't do any health-related testing on that sample. But if you do work for law enforcement, your employer is allowed to get a sample from you of your DNA. There are some genetic variants that put us at greater risk of having a toxic reaction to different chemical exposures. And if you work in that environment, that employer is allowed to genetically test you for those risks, only specific to those exposure risks. And if you were one of those people who had that risk, you definitely would want to know. So this, again, is an exception that advocates also supported. The last one has to do with employer-sponsored wellness programs. We actually heard a lot about that this year with healthcare reform. Lots of language in that bill and funding for programs to promote prevention and wellness activities. And I'm going to come back to talk about this because it's a complicated issue and it's one that's not resolved. And it's a great example of how GINA is going to be continued to be challenged and why all of us in support of it are going to have to continue to advocate for this bill to stay intact. So I'm going to come back to wellness programs in a bit. Both in the bill, the legislation that signs into law defines what is genetic information, so what's protected under GINA. This slide is verbatim from what was signed into law by President Bush. This is all the information. So you can see it includes your testing results, your family history information, and your family members' diagnoses. Essentially, it includes everything you can imagine. It's a very broad definition. It even includes the fact that you went and spoke to a genetic counselor or you participated in genetics research. So essentially, everything is covered, which is great. Definition of genetic test, again, very broad. It essentially says on the slide, anything that can infer or indicate what your genetic makeup is, what your genotype is protected under GINA. The definition of genetic tests and genetic information were one of the most highly debated issues when we were fighting for this bill. The opponents were trying to narrow this definition down so small so that if GINA ever passed into law and took effect, it'd be very limited in what it protected. By keeping these definitions as broad as they are, we've greatly expanded the scope of protections that you have under GINA, and this was a huge victory. So this is one of the strongest points of GINA. This is, it was a huge win and a huge point of contention. And just the fact that your employer and health insurance company cannot request or require your genetic information, that the definition of genetic information is so broad, really makes GINA an incredibly valuable civil rights bill to have in place. I want to take a second, though, and point out the last bullet. I underlined manifested disease. GINA only protects predictive risk information. If you are currently affected with a disease, GINA does not apply to you. There are other legislation signed into law that does protect you, such as HIPAA, the Civil Rights Act, the Americans with Disabilities Act, all of which protect you in employment and or in health insurance. But if you have had those symptoms, you fall in that. But otherwise, it does not cover GINA. So, for example, if you carry a BRCA1 or 2 mutation, but have no diagnosis of cancer, your risk information associated with those mutations are protected under GINA. If you have a mutation and you currently are having chemotherapy for breast cancer, your diagnosis of breast cancer is not protected under GINA. That's a manifesting disease. Insurance companies can use that information to make premium and other underwriting decisions. Let's make sure that's clear. If you are a mutation-positive person and you have breast cancer is not covered. However, the risk associated with that mutation for a recurrence of breast cancer or for a diagnosis of ovarian cancer or other associated cancers with that mutation are protected under GINA. So that's a key point here. So it gets a little complicated because even if you are manifesting one type of cancer, all of the other cancers and health concerns associated with the mutation are still protected under GINA. So you don't lose GINA for everything if you get one type of cancer. But again, if it's manifesting, it puts you in a different category. Now, the regulations that the agencies put in place to interpret this, again, this was one of those points of contentions where the opponents of GINA were really arguing this with the supporters and how to interpret it. And fortunately, the interpretation is really in our favor and really strengthening GINA. And for example, one of the interpretations is the example they gave was for a disease called Huntington's disease, which is an inherited neurological disease that affects people. They first start showing symptoms in their mid-30s to mid-40s. There's no treatment, and if you have the mutation, unlike with breast cancer, unlike with hereditary cancer syndromes, if you have a mutation in the Huntington's disease gene, you will with 100% certainty develop the disease. GINA protects that information. So it interprets having that mutation as being predictive and it's a risk for developing Huntington's disease and not affected and it's protected. That was a huge win for us because you would think if something says with 100% certainty you're going to one day be affected, that would be the equivalent of manifesting disease. But government said otherwise, and they said no, that's protected under GINA. So again, these definitions were really nice and broad, and the interpretations were great. However, there's going to be these questionable gray areas, just like with minimal information collected. There's going to be what some gray area around manifested disease. And one example, I just put up a slide that lists all the different protein markers you might have on a breast cancer tumor that all give information about what type of treatments your cancer would respond to. And so there's some debate still in gray area and uncertainty around whether if you have a HER2 positive breast tumor and are a candidate for Herceptin, is that information about manifesting disease, or is it predictive and protected under GINA? And the reason why there's question there is because there's some research that shows having a HER2 positive tumor tends to indicate that it might be a more aggressive form of cancer and more likely to have a recurrence. So that information is predictive, and it's genetic. And so there's this back and forth debate about this issue. The bill and the regulations did not address or answer this question. And so again, this is one of those areas you're going to continue to see debate down the road. And as the bill gets interpreted in the real life settings and insurance companies implement GINA and try to comply to it, you're going to see cases such as this pop up, and people might take it to court, and you're going to see court decisions that will further interpret the bill. So I said GINA only protects health insurance. So it does not protect life insurance, disability insurance, or long-term care insurance. This was a point of negotiation in the debating GINA, and just, I'm not sure if everyone knows on the phone, but GINA was in Congress for 13 years. It took 13 years to pass this bill. And pretty much everything I've discussed so far was debated at one point or another. And this was something that everyone agreed on, that insurance companies can use your genetic information to underwrite life, disability, and long-term care. We're only concerned about health information. GINA does not protect those in the Indian Health Service. So again, there's limitations to the protections depending on what kind of insurance you're going after or what you get. However, I mentioned that the agencies interpret the bill. The Department of Health and Human Services, or HHS, their Office of Civil Rights, was also tasked with interpreting some sections of GINA. And they interpreted it to mean that GINA applies to every single HIPAA-eligible entity. So any entity that comes underneath their purview, they felt GINA applies, and that includes long-term care insurance. So the Office of Civil Rights, by interpreting the bill, essentially expanded the legislation to protect genetic information. It can't be used in long-term care insurance. Now, I said GINA took effect in November, and we're all covered and protected under it. However, the regulations from the Office of Civil Rights have not been finalized. They were released last October in draft form with comment period. People such as myself provided comments, and we're lobbying for and against the regulations, but they haven't been finalized yet. And until they're finalized, there's this gray area, because an employer can always say, or a health insurer can say, is I tried to comply with GINA to the best of my knowledge, but the regulations were incomplete. So they kind of, not necessarily get out of jail free card, but kind of close to it, that until the regulations are completely final and the ink's dry, there's always going to be this wiggle room. And so we're hopeful that when the final regulations come out, the Office of Civil Rights will have kept in there that extension to long-term care insurance. This was huge. I should also add that anyone who is a federal employee who works for the federal government, you already have these GINA protections. President Clinton signed into law with an executive, or not into law, signed an executive order that protected all federal employees from discrimination in the workplace and in health insurance. So federal employees are protected, people in group and individual plans are protected, but if you're in the Indian Health Service, you're not protected. You're also not protected from GINA if you're in the military. GINA does not cover or apply to enlisted soldiers and to veterans' health plans. However, the military has taken action in 2008 to come into line with GINA on their own. Before that, the military was a bit aggressive in how they looked at genetic testing. They still, to this day, at enlistment in the military, they automatically do testing for about a dozen or so hereditary diseases. And the reason why they do that is, for example, they'll test for sickle cell anemia, because if you carry sickle cell trait, you're a carrier for that disease. They wouldn't want to put you in a high-altitude environment because you're probably going to get thrown into a crisis and have some major health issues. So they test people not necessarily to say you're not eligible or to kick them out of the military. They test them to make sure that they don't put them in a life-threatening situation. For example, if you have a clotting disorder, they probably wouldn't want you to be a pilot because you're going to be in high altitudes and you'll probably be at risk for getting a clot. And so they did these genetic testing. So there was all this concern that GINA doesn't apply to the military when the military is one of the biggest genetic testing employers around. But in 2008, they said that if they changed their policy to say that if they diagnose you after 6 months, if you're in the military for 6 months and you're healthy and you have no problems, and then you develop a genetic disease, you're covered, you're good. You're going to get all your military benefits, you're going to be fine. If you get diagnosed within those first 6 months, then they'll consider it a pre-existing condition and you won't be covered. So the military, unfortunately, these soldiers dedicating their lives to protect us don't have the same protections under GINA that you and I have. So it's a major, major gap in the bill. Another interesting example that again, I said GINA is going to be interpreted over and over again, and since it's signed into law, all these really funny, interesting examples have popped up where we never anticipated GINA would come into play, and one of those is Major League Baseball. Apparently, the baseball league uses genetic testing to confirm the identity of potential athletes they want to sign, mainly to confirm their age. I guess the difference between a 16-year-old and a 20-year-old is pretty dramatic in the world of baseball if you're recruiting an athlete for your professional team. And a lot of players from impoverished countries, such as the Dominican Republic, will switch birth certificates with a younger family member or a friend so that they can be more eligible to come to the U.S. and play in the sport. Baseball was collected from their identity. Well, GINA makes this illegal. So again, just something that was going on that none of us working on this bill for 13 years ever thought that baseball would be an offender of GINA. But yeah, the Major League Baseball was violating GINA, and they had to stop their practices. They're going to have to find another way to confirm age of their athletes. So I said we talked a lot about the strengths of GINA with the broad definition. We talked about some of the gray areas that those of us in support of the bill think are really, really strong, and those of us who oppose the bill think there are loopholes we can take advantage of. But one of the things that I like to point out is I personally think GINA has weak penalties. Other advocates would say that I'm wrong, that they're really proud of the penalties in GINA. But this was something that we negotiated a lot on in getting the bill passed, and it was something we conceded on in order to get the bill to move and get the opponents to back off a bit. And that basically says you're not allowed to just hire a lawyer and feel that your boss or your health company has discriminated against you. GINA doesn't let you just go out and hire someone and sue. You have no private right of action. GINA requires you to first complete all of the administrative remedies. So in the bill, for example, if you feel your employer discriminated against you, you file a claim with the EEOC, the Equal Employment Opportunity Commission, who handles all forms of discrimination claims in the workplace. And you have to exhaust that process. They then have to decide whether or not there's merit to your case, and if so, they move forward. They go after the employer on your behalf, and so on. You have to exhaust all of those before you can actually file your own civil lawsuit. So to me, that's weak. Some people would say, no, there's actually effective remedies in the bill, and it's a very strong bill. So this is my personal take on GINA's penalties. In the last bullet, I'd like to point off, because I'm sure all of you on the call right now, I can't even imagine how many questions you are typing away. It's a very hard bill to interpret, and there's lots of confusion about every aspect, whether it's the definition or what's manifested disease, what's minimal information necessary. And I think it's going to be very difficult for the public and people such as yourselves to be aware of what does GINA mean and when are my GINA rights being violated. So I think it's going to be really hard for plaintiffs in general to just have that awareness and file cases and file claims, because it can be really hard to discern if what your health insurance company or your employer just did violated the bill. So it's a great bill. I'm so thankful it was passed. I'm very happy, but the one criticism I always say is I think the penalties are a bit weak. I want to just pause and say that it should be NINCHPEG. It's a coalition that educates healthcare providers in genetics. The Genetics and Public Policy Center and the Genetic Alliance have partnered to develop educational materials. I'm part of the group that's writing those. They should be out in the next month or so, and they're going to be great. They include discussion guides for clinicians, so your providers, as well as giving case scenarios to explain some of those tricky GINA issues, what's protected, what's not protected under the bill, and they're going to be really helpful. And I'll definitely let Forrest know when we finish the project. I just want to make sure you're aware of that coming out this spring. Many of us that are working on that are also working together right now, just now starting to form the group, so it'll probably be late summer when we finish this project, but to go through the healthcare reform bill that was just signed into law to see where it interacts with GINA and how they complement each other, and where does it expand protections under GINA and where does actually GINA go further. So we'll hopefully have that resource for everyone as well later this spring or later this summer. So again, keep your eyes open for them. They're going to be really helpful tools and their pamphlets to keep around for when you're thinking about your rights and making sure they're protected. So I kept talking about these regulations and how important they are in protecting GINA, and I said the Title II regulations from the Office of Civil Rights still aren't finalized. People are still lobbying that office, trying hard to change them, both to make them stronger and to weaken them. And it's going to be extremely important in defining the scope of GINA and our protections and how those regulations are finalized. And what I want to do is I said I was going to go back to wellness programs. And it's a great example of how opponents got very close to essentially wiping out almost all of your protections under GINA with one amendment to healthcare reform. And I'm gonna kill the suspense and say, don't worry, it didn't happen, but I'm going to tell you the story. So employers are getting more and more popular as they're starting wellness programs with their company. And the idea of a wellness program is if you get someone to enroll and you can get them to lose weight, exercise more, eat healthy, and just generally improve their wellness, you can prevent diseases and chronic conditions like diabetes, and that will eventually reduce the long-term health care costs of the employer because they'll have a healthier workforce, less absenteeism, less health care costs because they don't have diabetes. So the concept behind wellness programs is wonderful, and most people support them, including Congress, the President, the American Heart Association, etc. Where it gets tricky with wellness programs is that employers are more and more now using health risk assessment forms where they're collecting very personal health information, and they're saying they need this health information so that they can then steer you into the correct preventative services. People say, everyone's at risk for diabetes, everyone needs to exercise, everyone needs to eat well, so you don't need to know my individual risk to put me in a wellness program. But some employers really want to target it. They want to put them in, give them additional preventative screenings if they're at risk for cancer, etc. Now, GINA says there's an exception in the bill that says an employer-based wellness program is allowed to collect your genetic information, so again, family history or your test results, is allowed to collect it if that wellness program is voluntary. You can't be coerced to participate and give up that information. So you go look at the other laws, such as the Americans with Disabilities Act, and that law and other ones say that if a wellness program offers a cash incentive, $50, $300, an iPod, a free gym membership, any cash incentive, it's no longer voluntary, it's now coercive. Because if you choose to keep your health information private, you're getting penalized. You're not getting the reward. You're actually getting a penalty. You're getting punished because you don't get what your coworker gets because you chose to keep your information private. GINA says if there's that cash incentive, wellness program is no longer voluntary, you're not allowed to collect genetic information. So if an employer wants to use a cash incentive to get someone to enroll in a health care plan, they can do that. They just can't collect your genetic information. So employers, such as big employers do this, like Safeway, grocery stores, has huge wellness programs, huge. And so all of these employers are starting this up, and they really were lobbying hard this year with healthcare reform, and especially in the Senate side last fall, trying to change this GINA provision. And they actually let me stop and say this, to give you an idea how specific those health risk assessments is. This is verbatim taken from Health Media, one of those, so wellness consulting company, they actually run wellness programs for large employers. And look at the questions that they were asking on their health risk assessments. And these are incredibly specific questions. And when I saw this, my jaw dropped because as a genetic counselor, I quickly recognized what they were asking. Essentially, this is the GAL risk assessment model that the NIH validated that I'm sure most of you, when you met with a genetic counselor, he or she took you through these questions to calculate your risk of cancer and your risk of hereditary cancer. And so to me, it was, is this really an employer-based wellness program, or are they trying to practice medicine? And so it's really frightening to think that employers are going to get access to this specific information about you. And that's what they were trying to do. And they got really successful, and they found a senator willing to offer an amendment to the Health, Education, Labor, and Pensions Committee, which was the committee in the Senate that first had the opportunity to change the health care reform bill, that essentially said wellness programs are exempt from complying with the Americans with Disabilities Act, the Civil Rights Act, and GINA. I mean, and talk about a bold move. I mean, to basically say, if you participate in a wellness program, you give up all of your civil rights. All of these major important bills that we've passed and signed the law that have protected us for decades, you have lost your rights to. I mean, it was really just unbelievable. And they got a lot of traction. And all of us who advocated for GINA had to get back together and really just organize quickly and start lobbying Congress to make sure they didn't create the significant loophole where employers were going to be able to collect your genetic information and you have to give it up if you want to enroll in the wellness program. It was really frightening, and fortunately, we had a lot of people sign on to the bill, onto the letter, and opposing it, and we were successful, and it was not added to the health care reform bill. But this is a great example of people who oppose GINA just constantly trying to look for opportunities to undermine and weaken the bill, and they got pretty close. They weren't able to get around this issue of is a cash incentive make a wellness program involuntary. The Office of Civil Rights regulations address this. They define what type of information and in what context a wellness program can collect it. And I said those regs are not final yet. And so there are people still trying to change the interpretation of this exception in GINA. And we're just still fighting really hard to make sure that the draft regulations look a lot like the final ones in the end, and that the wellness programs are not allowed to coerce you into giving up your private information. So again, it's a complicated bill to figure out if your rights are being violated, and there's going to be constant challenges to weaken GINA. And just because it's signed into law doesn't mean all of us advocates can we should definitely celebrate, but we can't just look the other way. We really need to pay attention and make sure GINA's protections don't get weakened over time. And I always like to end with Senator Kennedy, who just was just incredible advocate for all civil rights. And when the bill was on the Senate floor being voted on, he said it's the first civil rights bill of the 21st century. And I think that's really true, that we are in a new era of medicine, and it's amazing to have this protection in place. So I give you all my contact information if you have additional questions, and I know we're going to have questions on the call as well. So Barbara, I'll leave it up to you if you want to shoot some questions.
Thank you. Can you hear me?
Yes.
Okay, great. So I have to start with wow, because I don't think I had any idea how much I didn't know about GINA until you just went through this. So I have my own questions, but I'm going to start with the questions that people had typed in. You did answer a lot as you went along, but we do have a question around DCIS, and I don't know if you know this, but whether it's considered cancer legally under the definition and how it fits into this.
So again, that's a great example that the regulations did not address, and it's a gray area, and it's one to challenge. The closest example that the regulations had is they said if someone has a mutation in a hereditary colon cancer syndrome and they have 2 polyps, it was considered manifested disease. And I guess that would be the closest I could get, but unfortunately it's the gray area that's going to be open for interpretation. My hope and other advocates' hope is insurance companies are going to be so afraid of violating GINA that they're just going to say it's protective. But again, it would matter if you have DCIS and you have a positive mutation status. It's still somewhat gray as if it's protected, but I would like to think it is.
Great, thank you. Somebody asked if you could repeat the info, so you may want to go back some slides, about being BRCA positive and already having breast cancer. And what does that mean? So do you know what slide that was?
The definition.
Okay.
So manifested disease. So I think that's probably what they're asking. If you have a mutation and you have breast cancer, your breast cancer diagnosis is not protected under GINA. It's manifesting itself. You have the disease. You're going through treatment. It is protected under HIPAA and other laws, but not under GINA. But your mutation status will always be protected. So your risk for ovarian cancer, even if you have breast cancer, your risk for ovarian cancer is protected. So I hope that clarified the question.
It did for me. So a question is, what can be done to protect us in the areas of disability and life insurance other than purchasing those policies prior to any testing? I didn't see a good answer in your presentation, but maybe there's more.
As a genetic counselor, that would be my answer, is buy those policies before you get your genetic testing done. There's no, right now, there's no protections for that. The insurance companies can use your genetic information for underwriting life and disability. So right now, my advice would be to get those in place before you pursue testing, if you're concerned about it. My other advice as a genetic counselor is always put your health first. And genetic discrimination is rare. It's not rampant. It's not happening every 5 minutes. In many ways, GINA was preventative medicine, and that we put it in place hoping it will prevent cases of discrimination, but it's not going on widely. So never postpone health care treatment or testing if it's going to be life-saving for insurance. It's not worth it. But yes, if you want to be absolutely safe, you should probably get that in place before you get the testing done.
Okay. This is actually a good follow-up to that. So this person is saying, I understand from this session that GINA does not include life insurance protection, but are you aware of any life insurance carriers declining coverage or increasing premium due to a BRCA positive history, and must I disclose this information?
I don't know of any cases, but again, I'm not working in a hereditary breast cancer clinic talking to families wrestling with this, so I don't know. When I was doing clinical research and I was working in neurology, and I had a patient who was at risk for Huntington's disease, and he applied for life insurance, and they asked, have you been diagnosed with Huntington's disease? I mean, the question was right there verbatim, and he said no, because he hadn't been diagnosed yet at that point. I mean, he actually tested negative, so he never was, but he said no. But had they asked the question, has anyone in your family been diagnosed, he would have had to say yes. So I think insurance companies are getting savvier, but they're not quite there yet. And you know, if you lie, they give you a form and you lie on the form, or you give them misinform them, then it's fraud. So I think that, you know, if they ask you for the information, you have to give it, but I don't know if they're asking about hereditary cancer status. I really have no idea, but I imagine it is going on.
We do have one person who had asked the question about DCS who actually did have life insurance declined. as a result of the DCIS and probably the genetic testing that went with it. So,
yep.
Yeah. Okay. I had a question, which is, so I see that you're going to be doing a lot of work, and already just being on this webinar is very helpful, and you're going to have some guides out. Where do people go? Because, I mean, obviously there's a lot of information on GINA on the Force website, but that's really at kind of the high level. Where do people go when they feel that they might have had an issue, that they have to go through that administrative process?
Yeah.
Who's the advocate for them?
So the government has offices set up where you can call if you feel your rights are violated, and probably the best place would be the EEOC, the Equal Employment Opportunity Commission. The Department of Treasury, Department of Labor, and Department of Health and Human Services all have roles in overseeing GINA, and they all have different offices that you can reach out to, but the EEOC would be a good place to start. For more information on GINA, the National Human Genome Research Institute at NIH has information on their website, which is genome.gov, and the Genetics and Public Policy website, which is dnapolicy.org, also has really great information. And then once these materials are done, I think they'll probably be up on the Genetic Alliance website and easily accessible.
Do you expect there'll be people in private practice, whether, I guess, legal advocates, who might be doing this as part of what they do to help guide people through this?
I think so. I mean, after the American with Disabilities Act passed, the whole area of disability law came to be, where there are people who focus their careers in protecting those rights and making sure people aren't discriminated against. And I imagine it will similarly expand to genetics. I was in a restaurant a month ago, and on the wall noticed they had posted, in all workplaces you have to post your civil rights. And it was the new one, and it had a section on genetic information, and it was really exciting to see it out there next to the Civil Rights Act, and you can't be discriminated based on your age, gender, et cetera, to see genetic information up there. It was pretty exciting. So I do think that there will be an expansion in that field. And again, there aren't many cases of genetic discrimination going on right now, so I don't know if it's enough for someone to do their sole career in it, but I do think we'll see more and more cases, both with the employers and insurance companies challenging the bill, and both with people such as ourselves who feel we've been violated against.
Great. And also from somebody who had previously posted a question, I think this is a perfect way to end this. Not a question. Please thank Jennifer for her work, and I would like to echo that. Obviously, you have spent a lot of time on this and advocating for the community, so from me as well, thank you. And that is it. That is all the questions that we have. I really appreciate your being on the webinar tonight, and I already told you I plan on bringing you back after you get the health care reform bill and talk about that a little bit more, and so we hope to have another session with you soon.
My pleasure. Thank you very much for the opportunity. I really enjoyed sharing GINA with the public. It's great.
Thank you. And thanks, everyone, for attending. And again, the webinar will be posted on our website within the next 2 days. You can now log off. Thank you.